Hi, my name is Dr. Andy Smith. I'm the President and Chief Executive Officer here at Sunnybrook. At Sunnybrook, we're known for being able to take care of Ontarians with really complicated health problems. For specialized, complicated types of care, it's really important to have a concentration of teams and resources to be able to provide care that can't be provided in all hospitals across the province. Many times patients are transferred to Sunnybrook, sometimes really quite unexpectedly from far away in the province. However, when you're ready to be able to be safely taken care of at home, we work together with partners to be able to transfer you from Sunnybrook to the hospital that's closer to your home. There's a lot of benefits to this, including the fact that it's very nice to be close to home and close to family and loved ones when you're recovering from illness. We call this process of moving patients or transferring patients together with partners, when we move from Sunnybrook to a hospital closer to home, repatriation.
Hi, I'm Darlene. I'm one of the team members involved in moving you closer to home. Sunnybrook has a special team that coordinates these moves. This team plays a role in communicating with you and your family about moving your care closer to home throughout the process. Moving your care closer to home ensures that we have the right type of bed for the right person at the right time to allow us to deliver the best possible care. Patients will go back to their home hospital or a designated hospital that can look after their care needs. You and your family will be told by a member of your Sunnybrook care team when you're ready to have your care moved closer to home. We may not know what day you will go to your close-to-home hospital, as that will depend on your condition and if you are ready from a health status perspective. Sunnybrook will give you support along the way by keeping you and your family informed on your progress. You should get regular updates from the care team. Sometimes it could take a little while to ensure all the pieces are in place to get you closer to home. This includes having a bed available at the other hospital and ensuring the other team is ready to take care of you. This process can sometimes happen quickly, and the patient may be notified that they are going to a hospital closer to home on the same day. In the process of moving care, there will be full team input in terms of recommendations for treatment and therapies, family supports, liaising with private providers, access to specialized resources so that optimal care goals are achieved. Moving you closer to home can happen at any point in your stay at Sunnybrook, but this will only happen when it is safe to transfer you. Sunnybrook and the receiving hospital will be in communication about your health status. You can move to a close-to-home hospital even if you are still in the intensive care unit, and the other hospital has that level of care to continue treating.
My name is Lisa, and our family has been through the repatriation process. On Christmas Eve, my brother-in-law Doug had a stroke up in Barrie and was brought to the Royal Victoria Hospital and then had to be transferred to Sunnybrook Hospital for his care there. After his care at Sunnybrook, he was then repatriated back to Royal Victoria Hospital in Barrie. As a family, having been through this process, I think there's some really important questions that you can ask your care team in order to help to make this process a bit easier. We asked early on, would he be going home at some point, or when approximately would he get closer to home? So they were really great at explaining when that would happen. But then it happened very quickly once it did happen. And so what I would suggest is that we continuously sort of ask and maybe check in every couple days to say, is there a plan to go home yet? And just be confident to ask those questions and say, what is the plan for returning home and when is it going to happen? I think one of the other things that we should really encourage is to ensure that you have some sort of documentation or that you have your chart with you. Sunnybrook has a great thing called My Chart, an electronic patient record. If the information hasn't come along with me, I can access the My Chart and then you can take a look if you have any questions. I would also encourage family members to ask what that plan of care will be when I get to that hospital. And not wait until we get to the hospital to ask it, but really understand from the discharging hospital. So what will my plan of care be when I'm there? And have you consulted and talked to the people over at the other hospital about what that's going to be, just to smooth out that transition a little bit? What do I need to know as a caregiver, as a patient? What should I remember and what should I bring with me when I'm discussing my care plan with my care team over there as well?
We've worked really hard on repatriation and how we can do that together with partners in Ontario. We are dedicated to making it an excellent patient experience where patients and families can be confident that their care is going to be excellent, that the transfer will be seamless, and where patients and families really have a sense that we work together as Team Ontario in providing the best possible care to ensure your return to wellness.